So we are here with Dr. Arun Sanyal. He's a professor of Virginia Commonwealth University and one of the greatest leaders in MASLD worldwide. And I would like to address you two questions, Dr. Sanyal. First of all, when should we think about combination medications on MASLD treatment?
I think first of all, when you think about areas of the world where access to the drugs that have been approved in the US, that is resmetirom and semaglutide, are not yet widely available, then you have to think about off-label use, using other drugs, particularly those that are affordable by patients. So in that setting, something like a combination of low-dose pioglitazone to limit weight gain along with vitamin E is still a viable option. Of course, there's GLP-1, and those people who have access to GLP-1 and resmetirom, particularly those who have advanced fibrosis but not full-blown cirrhosis, where we think they have both very active disease and they have a lot of fibrosis, that may be a population ideally suited for combination therapy. And the third group are people who get partial response to monotherapy, where you could add another drug to make them a full responder.
Perfect. Another question. We know that MASLD is an independent cardiovascular factor of risk. Should we include MASLD on the algorithms to evaluate cardiovascular risk?
Yeah, I think this is coming because for sure we now have no doubt that having fat in the liver is a risk factor for cardiovascular disease, independent of obesity, independent of the classical risk factors for cardiovascular disease. And at the very least, I think we need to educate our colleagues in the cardiovascular and diabetes space and even primary care that when they're thinking about cardiovascular risk, the liver piece should not be left behind, and at the very least, a FIB4 should be computed. And if the FIB4 is over 1.3, do have them send the patient over for secondary testing with either elastography or with a ELF test.
Perfect. Thank you very much.
Absolutely.
Thank you, Doc.